Do you wake up in the morning and the very first thing you notice, before you even check the time, before anything else, is that your mouth feels like sandpaper, like every drop of moisture was completely sucked out overnight? Your tongue sticking to the roof of your mouth, nothing there to swallow. If that sounds familiar, stop what you're doing and listen carefully, because what your family has been calling a minor annoyance, or worse, just part of getting older, is neither minor nor normal. I am Dr. Thomas, and in over 2 decades focusing on senior health, I have watched this single symptom quietly destroy lives, not dramatically, not overnight, quietly, slowly, in ways that only become visible when it's almost too late. Here is what the research actually shows. A 2022 analysis in the Journal of the American Geriatric Society found that chronic dry mouth, medically called xerostomia, has a 61% statistical overlap with the 4 most dangerous health crises in adults over 60. Aspiration pneumonia, systemic infection, progressive malnutrition, medication, toxicity. For conditions that together cause hundreds of thousands of hospitalizations every year in this country, all connected to something you woke up with this morning. Gentlemen, take 1 second to support this channel. Subscribe for latest videos. Okay, before I give you the 7 warning signals your dry mouth is hiding, I need you to hear what happened to Alicia, because Alicia's story is the reason I'm making this video right now. Type your age in the comments, and whether you wake up with dry mouth, yes or no, you'll be stunned. How many people watching right now have never once mentioned this to their doctor? Alicia was 60, a retired receptionist from outside Texas, the kind of woman who spent 30 years serving for everyone else and never once wanted to be a burden. So when she started waking up every morning with a mouth so dry she kept water on her nightstand just to speak, she said nothing to anyone. She figured it was aging. She figured it was normal. For 18 months, Alicia woke up like that every single day, and during those 18 months, her body was screaming in the only language it had left. She lost weight without trying, just a pound here, 2 pounds there, until her daughter noticed her clothes were hanging wrong. She had trouble swallowing dry foods. She got a chest infection in spring, another in fall, another the following winter. Each time antibiotics, each time sent home, and each time nobody asked the question that should have been asked. Why does this woman keep getting chest infections? Then came the 3rd hospitalization. Alicia woke up one Tuesday morning unable to breathe, lips slightly blue. Her daughter calling 911 with shaking hands, her oxygen saturation had dropped to 81%. Healthy adults sit at 95% or above. The diagnosis from the pulmonologist stopped her daughter cold, aspiration pneumonia, severe, developing, not over days, over months. Here is what that means and why it matters to you directly. Every night while Alicia slept, bacteria from her dry, unprotected mouth were being microscopically inhaled into her lungs. This is called microaspiration. It happens to everyone during sleep, but in a healthy mouth, saliva neutralizes those bacteria before they can travel anywhere. Saliva contains immunoglobulin, allosaccharine, your mouth's immune checkpoint. Alicia's mouth was dry. That checkpoint had been dismantled, and for 18 months, bacteria have been making their way into her lungs every single night while she slept peacefully, completely unaware. 19 days in the ICU, intubated, permanent lung damage. And here's the part that haunts me. When Alicia's daughter Linda went through her mother's medical records during those 19 days, she found that Alicia had been on 5 medications for 6 years, and not one physician had ever reviewed how they interacted with each other. 3 of those medications, a blood pressure pill, an allergy antihistamine, a bladder control drug, all belong to a class called anticholinergics, among the most aggressive suppressors of saliva production in modern pharmacology. Alicia's dry mouth wasn't a side effect. It was her body sounding an alarm for half a decade, and nobody listened. This was not bad luck. This was the predictable outcome of a problem affecting 30% of adults between 65 and 75, and nearly 40% of those over 75. And it comes down to 5 things most doctors never clearly explain. Today, I'm explaining all 5. First, saliva is not just for chewing. It is one of the most biochemically complex fluids your body produces, containing over 700 proteins, enzymes, and antimicrobial compounds. It is your mouth's immune system, your digestive ignition switch, your throat's protective lining, all at once. A 2021 UCSF study of over 12,000 seniors found that those with confirmed dry mouth were 2.88 times more likely to be hospitalized for respiratory infection within 24 months. Nearly 3 times the risk hiding in a symptom most people dismiss before their first cup of coffee. Second, medication combinations are far more dangerous than anyone tells you. Over 500 American medications list dry mouth as a side effect. Blood pressure pill, antidepressants, antihistamines, diuretics, bladder drugs, sleep aids. When seniors take 3 or more of these simultaneously, research from the Journal of the American Dental Association in 2023 found the suppression effect doesn't add up. It multiplies 3-0. Genic medications don't cause 3 times the dryness. They may cause 6, 7, or 8 times the salivary gland suppression. This is called compounding xerogenic effect, and almost no one discusses it during prescription reviews. Third, dry mouth causes malnutrition, even when you're eating normally. And this one surprises every patient. I tell it to saliva triggers your entire digestive process. It contains amylo yeast to begin breaking down carbohydrates and sends chemical signals to your stomach to prepare acid for digestion without saliva. That signal goes quiet. Nutrients pass through without being properly absorbed. A 2022 Mayo Clinic study found that 44% of seniors diagnosed with unexplained malnutrition had clinically significant dry mouth that had never been identified as a factor. You can eat 3 meals a day and still be slowly starving. Fourth, a dry mouth is an open door for bacteria to reach your heart, brain, and bloodstream. Your mouth hosts 700 species of bacteria in a carefully balanced ecosystem regulated by saliva. When saliva disappears, the dangerous ones, strep mutans, poor romanus jingle, this Fusobacterium, nucleotum, surge within weeks, and according to research in Nature Reviews Microbiology in 2023, they do not stay in the mouth. They enter the bloodstream through microscopic gum tissue breaks and have been directly linked to heart valve infections, worsening diabetes, accelerated cognitive decline, and sepsis in vulnerable seniors. Fifth, dry mouth is almost never just one thing. It is your body's way of flagging something deeper that hasn't been diagnosed yet. And that brings me to the 7 warning signals I promised you pay close attention to this section, because this is where most doctors completely drop the ball. Before I give you the list, I want to ask, how many medications are you currently taking? Just type the number in the comments, because the second story I'm about to tell you is critical, if that number is 3 or higher. Robert was 68, a retired firefighter from Atlanta, 31 years walking into burning buildings. So when dry mouth woke him every morning, he did what tough men do, he ignored it. 2 years passed, then the tooth pain started. When his dentist, Dr. Simmons, looked inside his mouth, she paused before speaking. 8 teeth destroyed by aggressive decay in 14 months. She had only seen numbers like that in radiation patients. She started asking questions. Discovered Robert's acid reflux medication, combined with his blood pressure diuretic, had chemically stripped his mouth of protective moisture for 2 solid years. But the teeth weren't the worst part. Dr. Simmons took a bacterial culture. What came back made her reach for the phone. Immediately, Robert's oral strepsirrhus mutans, Levels were among the highest she had seen outside a hospital. A 2023 Johns Hopkins study of 8,400 men aged 65 to 75 found elevated oral streptococcus mutants was associated with a 34% increased risk of a major cardiac event within 18 months. Robert's cardiologist found early arterial inflammation. Medications were adjusted, dry mouth treated. Robert is fine today, but he was 6 months from a potential cardiac event, and a dentist asking the right question about dry mouth is the only reason he's still here. Now the 7 signals, here they are. Signal 1, ammonia breath with dry mouth. If your morning breath smells metallic or chemical rather than just stale, that is a potential kidney function warning. Request a kidney function panel signal 2, thick, ropey, or foamy saliva. This is not absence of saliva, but altered saliva. This is an autoimmune signal, Sjogren syndrome, lupus, rheumatoid arthritis. Request autoimmune screening signal 3, dry mouth only at night. If daytime is fine, but mornings are severe. This is a direct sleep apnea pattern. Your airway is collapsing during sleep and forcing mouth breathing for hours. Get a sleep study signal, 4 dry mouth plus frequent nighttime urination. This combination is a diabetes warning. High blood sugar pulls water from every tissue, including salivary glands, while driving up urinary output. Request a fasting glucose and HbA1c test immediately. Signal 5, dry mouth plus dry, gritty eyes. This is the hallmark of Sjogren syndrome, affecting an estimated 1 in 70 women over 60 and dramatically underdiagnosed. It is treatable but can progress to the kidneys, lungs, and nervous system. Signal 6, dry mouth plus leg or foot cramps. This combination flags a serious electrolyte imbalance, low sodium, potassium, or magnesium, especially dangerous if you take diuretics. An electrolyte crisis combined with dry mouth can trigger cardiac arrhythmia. Call your doctor this week. Signal 7, dry mouth, that started within 90 days of a new medication. This is your body telling. It needs a polyarm pharmacy review. The 90-day window is when anticholinergic suppression reaches its clinical threshold. Do not wait for your next appointment. Now what to do about it? 7 steps straight from my own practice protocol. Step 1 is the morning mouth assessment before you drink anything. Take 60 seconds. Is saliva present? Is it thin or thick? Any chemical smell can you swallow without water? Do this daily, and you have the data your doctor needs. Step 2 is the medication audit. Write down every medication, prescription, and over-the-counter, and check each one for the words anti-allergic or xerogenic. Then tell your doctor, I would like a formal Polypharm pharmacy review focused on my combined anti-linearic burden. Those specific words will change the conversation entirely. Step 3. Water does not fix dry mouth. Your salivary glands need electrolytes, sodium, potassium bicarbonate, to produce saliva. Plain water dilutes those further small sips throughout the day, paired with electrolyte or rich foods, is far more effective than a glass at bedtime. Step 4 is the nighttime protection plan. Elevate the head of your bed 4 to 6, and using bed risers, not extra pillows, run a cool mist humidifier at 40 to 60% humidity. Use a xylitol-based dry mouth rinse, never alcohol-based immediately before sleep. Step 5 is saliva stimulation, xylitol gum after meals, sour sugar-free candy to activate the paratha glands. Crunchy, raw vegetables with every meal. These are clinically supported, simple, and free. Step 6 is your doctor conversation script. Say this exactly. I've been experiencing chronic zero, say affecting my sleep, nutrition, and swallowing. I'd like to discuss whether my medications are contributing and request a salivary gland function assessment. Clinical language gets clinical results. Step 7 is the emergency red flag list. dry mouth with difficulty breathing. Emergency room now, white patches in your mouth. Call your doctor today. This is oral candidiasis, dry mouth with sudden confusion or weakness. Call 911 dry mouth with chest pain or rapid heartbeat. Call 911 dry mouth with unexplained fever. Same-day urgent care. Let me quickly address what I know you're thinking. Your doctor said it's just aging. Is that true? No. Clinically significant. 0. Stoya is almost always caused by a medication, a medical condition, or both. It's just aging is a dismissal, not a diagnosis. You have every right to push past it, and now you have the vocabulary to do exactly that. Can drinking more water fix it? No. Dry mouth is a glandular function problem, not a hydration problem. You cannot water your way out of a broken pump. And yes, if you wear dentures, dry mouth is still dangerous. Arguably more so, bacteria colonize beneath denture bases against your gum tissue aggressively without saliva to regulate them. You do not need natural teeth to suffer the systemic consequences of dry mouth. Now let me bring you back to Alicia, because her story doesn't end in the ICU. After 19 days, she came home weaker than she had ever been in her life. But Linda came home with a plan. She documented everything, every symptom, dismissed every medication, every interaction, missed. 2 medications were adjusted. 1 was stopped entirely. Within 6 weeks, Alicia's dry mouth was almost completely gone. Within 3 months, she had regained 7 of the 11 Bs. She had lost Alicia volunteers now at a senior center 2 afternoons a week. She hands out a laminated card. Linda made the 7 signals in large print. Over 200 of them given away for free. And every single time someone takes one, Alicia says the same thing. I thought it was nothing. It almost killed me. Please don't make the same mistake I did. I make these videos because every senior in this country deserves the truth. Their doctor doesn't always have time to deliver in 15 minutes. You should never have to fight to be heard, and you should never lie in an ICU bed wondering if one conversation, one answered question about a morning symptom could have changed everything. In the comments right now, type one word, Alicia. If you wake up with dry mouth and are taking this seriously today, medication. If you're on 3 or more medications and will request a review doctor if you're bringing this to your next appointment, then share this with one person over 60 in your life. One person, you may be handing them something that genuinely changes their health. In the comments right now, type one word, Alicia, if you wake up with dry mouth. Please don't wait. Act now before it's too late. Subscribe for more videos like this. Real research, real stories, real steps, no fluff. Bookmark this video and return to the 7 signals whenever you need them. Stay informed. Stay empowered. I'll see you in the next video. Take care. Bookmark this video and return to those 7 signals whenever you need them. Stay informed. Stay empowered. I'll see you in the next.